Pregnancy care advice, pregnancy risk. It is an oft-repeated phrase, my streeto sick or such a future, sick aunt. Why, what's wrong, do not know why, but her baby. Matra right to be the mother of the girl, the natural law. It is not an illness as the disease 510 da. Being young is a condition of the body. It is not a disease. So, from the beginning to the head should get rid of these thoughts. Pregnancy care advice. Pregnancy care advice. That's what the doctor said, the mother of a special needs before the physical mental preparation. When an adult woman to be mentally prepared to be a mother when her Santana Dharana should be. Not before. A mother holding a child before they are such preparations, as well as everyone else in the family. Below mentioned are some complications during pregnancy. Minimum preparation and awareness to deal with them, but there is no problem. It is very important to know. For example, shortage of blood, jaundice, convulsions, leg swelling, high blood pressure, excessive vomiting, abdominal pain, shortness of breath, especially in the lower abdomen, and displacement. Interesting is often get caught with diabetes or blood sugar. When urine is burning, decreased amount of urine or completely closed. But that day is not increasing abdominal size. Blood dripping vagina, bleeding, discharged Ragandayukta. Kara children not being able to feel the inside of the uterus. These problems do not worry about any of the above occurs is important to go to the doctor. What are the reasons I have mentioned before? Pregnancy becomes risky for the mother and age is very important. Pregnancy before age 18 years. 30-year-old is the first child. After 40 years of holding children. The fourth child after childbirth again. During the pregnancy before complications. After a certain period of time before surgery may be pregnant again. Girls' height relatively short, or shorter women bearing anemia and holding the twins. Pre Eclampsia during pregnancy, Pre Eclampsia. This is a major complication. It may be up to the death of his mother. High blood pressure, protein in urine, upper abdominal pain, vomiting, headache, etc. In the meantime, apparently is to create some complications. The placenta or placental problems, and some due to lack of blood supply causes the eclampsia. Egulta usually is when you become a mother for the first time, your weight, age over 40, high blood pressure, diabetes or kidney problems. There was someone else in your family are you eclampsia and isatma been several times. The placenta or placenta problems. Usually not seen any signs. Diagnosis is possible only through scanning. However, it is possible to detect the vagina as bleeding. The placenta partially or completely cover the cervix usually face. Pain in the uterus after the start of spring, when the mouth is opened, then the placenta, increasingly have come away from the wall of the womb. Samita more risky for those who have given birth to more children. The uterus has been in operation or earlier if the first child via caesarean gynecoloke much of the hormone thakagarbhabasthia relaxina to relax. But if it is more, then it becomes pain. For example, pain in the hip joint, the pubic bone and back pain may be due to down. It could be at any time during pregnancy. It can be seen after the first 3 months. Itching during pregnancy. Many of the hands and feet during pregnancy may be. It is usually due to liver problems. It could be anyone. However, if the history of this family, mother, or sister, it is very normal. Mother's weight during pregnancy. This is a major concern. Disrupt the child's normal growth is set to rise in proportion to the weight or the mother's lack of proper nutrition. This means eating a balanced diet of foods necessary to mother. A woman needs a balanced diet to the extent that normal, that he was holding the child when demand increases. It's very important to mothers, maternity cases. Pregnant women need extra food is mainly for 2 reasons. Keep one's own health, this means to create yourself for the upcoming birth. 2 fetus development and growth to keep. If the mother of the child's weight does not increase if you eat less food, will be deprived of essential nutrients. In the end, a young child will be born. One thing to keep in mind, there is no alternative to go to the doctor on a regular basis to avoid any complications. Whether anything, it's bound to have caught the checkup. and then the treatment will be possible. Manaka and Ekakani rest will be given to the patient. So a healthy, beautiful and prosperous mothers, to be careful, there is no alternative.